Hey, time out. Will these new oral GLP-1 medications help you with your maintenance phase? Hi, I'm Dr. Meghan. I'm an obesity medicine physician and trained coach, helping you cut through the pseudoscience and confusion in weight care. My approach combines evidence-based medicine with real behavioral change so that you don't just take medication, you actually transform your health. Stick around for clear, medically based answers to your weight questions. Welcome to Office Hours. Before we get started, as you know, these questions come from the community. So if you have a question, leave it in the comment section below or leave it on another video and I will find it and add it to the list. And as always, as a caveat, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I'm going to change it so it's more broadly educationally applicable. And let's get started. Are you concerned about the possible long-term negative effects of these medications? Now, this question is talking about GLP-1 medication, and I think this is a great question for many reasons. So thank you so much for asking it. But also, this is a question that I've never been asked about this medication in the context of diabetes. So I think it also brings to light that we question the weight loss medications in a way that we may not question other medications. Not this question in particular, but when I read this question, it reminds me of other things that have come up in the clinic. Thank you so much for asking this. Again, so this is number one, not a question that I've ever heard in the context of these medications, how they're treating people with diabetes. But just to answer the question straight on, I'm always concerned about the long-term side effects for any medication. And that is always part of the discussion that I will have with any patient in terms of, yes, there are risks and there are benefits. And what do we feel like is the right fit for you? There are long-term side effects with any medication. So for me, probably the one that comes up the most is, gastric motility and thinking about if this is going to be an issue for people later. But I have to say, in the years that I've been prescribing this, both for diabetes and for obesity, it really just hasn't come up as a very significant long-term problem. And again, I think that also heightens the need for people to make sure that they're monitored appropriately, because certainly there are going to be side effects short-term and long-term. The risk is there for anybody, but also if people are just kind of being thrown it's like a drive-through window that you can text some app and they'll just send them to your house and not really ask you any questions. There are reputable places to get these medications in person and online, and there are not so reputable places to get these in person and online. And so that's just a good reminder for everybody, buyer beware, make sure that you are getting these medications from a place where the clinicians are monitoring you and that they're asking you appropriate questions. Also, I think what is necessary to bring up when we talk about the risks of long-term side effects, such as, worsening reflux, worsening stomach motility, chronic constipation, those are all issues that need to be monitored very carefully, and can be issues that people have chronically on these medications. But also when we think about, what are the long-term risks, we also have to look at the flip side of the coin, which is what are the risks of not treating overweight or obesity? And I think we're all really familiar that these are very serious, life-threatening risks that a patient can be exposed to if they don't get their weight down to a healthy level. And that's across many different systems in the body. Diabetes, hypertension, sleep apnea, so many different types of cancer, reflux, the list goes on. And so for any patient, it's always a risk versus benefit conversation. But I think a very important part of that conversation is, what is the risk of not treating this? And that doesn't mean that it has to be medication, but for a lot of people, they've tried a lot of things, and for whatever reason, it's been very hard for them to stick with the lifestyle changes. And so now we have medications that are just another tool that might be very helpful for somebody to get to that lower, healthier weight. Do you think these pills will be a good option for maintenance? Okay. So this question is about the up and coming GLP-1 oral medications that are not, at the time of this filming, they're not released yet, but is in relation to the video I made about orforglipron and oral semaglutide, and I will link that down below. I think these, and of course, it really depends on pricing for a lot of this, because the price is going to drastically affect the accessibility. And the accessibility is going to determine how much we can use these medications. So if these pills come out and they are priced the same way that these pens were initially priced, and now I don't make these, I'm not responsible for the pricing of the medication. I don't make those rules. But let's say they come out and they're, for some reason, as expensive as the pens, that's going to really limit how they can be used, how flexible we can be with them in terms of using them with the pens. But for the purposes of this question, let's pretend that they are extremely accessible and that price is not a deterrent for people when accessing this. So I think that, and again, this is all theoretical because I haven't used these medications in practice. They're not available. But I do think there is a world where somebody could get down to their lowest weight on Zepbound and see if they transition to an oral medication that's daily, if they can maintain around the same level, and if not around the same, like in the same ballpark, like maybe they lose 20% of their weight with Zepbound, and then they can maintain it around 15% of their weight. So I also see that as a potentially very helpful way for people to get the maximum benefit out of that medication. And then maybe for financial reasons, if they have to transition over to an oral medication, that would be feasible for them. I also think that the oral medications will probably continue to drive the price down for the pens. So it's very possible that you may not need to transition for price reasons. And all of that is just, again, theoretical because these are not on the market yet. I also think they will be very helpful in terms of traveling for people. So and again, as another caveat, let's just say that the side effect profile is similar, and let's just assume that people are not having drastically different side effects on these medications. But let's say somebody's on Zepbound, they really like it, they're going away for 3 weeks on a camping trip. It would be really nice to take something else for a couple of weeks that isn't a pen, that doesn't need refrigeration, that is a little bit easier to carry. I think that would be a great option for a lot of people. It would make traveling a lot easier. But I would also love to hear, like, how do you think that these medications will change things for you? How do you think they will make things more accessible? How do you think they will make life easier if you've been on one of these injectable medications and you don't have a needle phobia? How do you see this helping you in the future in terms of making things easier? Please let me know. Next question. What do I need to do to get rid of the fat hanging around my middle? I'm losing inches everywhere except around my waist. Very frustrating. I am exercising and using weights. Thank you. Okay. Thank you for sending in that question. Okay. So I think there's a couple ways I want to answer this question. Number one is, if you're still not at the place where you have reached maintenance, like you're still actively losing weight. Number one, see where you end up, because some people, the last place they're going to lose weight is around the middle. And so that's just how our bodies are programmed differently. We all have places where we're going to lose weight first and we're going to lose weight last, and everybody's programmed a little differently. So if you're not at that stage yet where you're at the dose of medication that you are going to stay on, wait until you get to that dose to see what's happening with the midsection. And then number 2, when you're at that place, I think it's also important to make the distinction between superficial fat and visceral fat. So around the midsection, there is the weight that you can pinch, that's the superficial fat, and you can feel that with your fingers. You can grab it, right? It's outside the abdominal wall. Versus visceral fat, which is the fat that is located deep within the internal organs, deep nestled right next to your internal organs, and you can't physically touch that. It's behind your abdominal wall. As I've said before, it's not a great place that you want to have fat. You can tell if you do a DEXA scan, it will give you the amount of fat, and it's pretty accurate. But if you do a DEXA scan, you can actually see how much visceral fat you have. That can be a very helpful metric for people. But the reason it's important to know is it's going to inform what your options are, because if it's mostly visceral fat, there's, not much that can be done outside from what you're probably already doing, which is exercise, making sure you're eating how you want to eat, and taking a medication to help with weight loss. All those things are really going to give you the best shot at reducing visceral fat, but we can't really spot reduce that. There's a little bit of evidence that suggests maybe intermittent fasting helps with that, but there's nothing hard and fast that says for certain do this to reduce visceral fat, other than, general weight loss. But if it's superficial fat and you have reached your maintenance dose, and maybe you are really happy overall with how your clothes are fitting, what the scale says, all those things, but you have more superficial fat around the middle than you wanted, or you have some extra skin, then for those people, I think checking in with a plastic surgeon that has been recommended to you, that you like, or maybe that you've met with before, I think that's a really good option, because it's just the type of thing where I wouldn't waste time with like supplements or creams or anything like that. I would just see a plastic surgeon. And if this is bothering you enough and the finances make this feasible for you, you have options. So check in with a surgeon. Is this something that would be amenable to liposuction? Is this something that would be more along the lines of an abdominoplasty, like a tummy tuck? Like, just have them evaluate you for what the options are. What I want to really spare people from is, number 1, just like going around in circles with trying things that aren't going to work, like a cream or a lotion or a supplement. And number 2, I think if something really bothers you and you have the financial means to potentially see a plastic surgeon, I think there's, a lot of shame that's still involved in that. And I really think this is, the alternative is just like mentally spending a lot of time and effort going back and forth in your brain, but that doesn't actually fix the problem. So you might as well just see what your options are. And you don't have to tell anybody either. So if you're in the place where you're like, I would never get plastic surgery, like, I don't know, maybe for something like this you would. So think about it. It might be an option for you, and it can be just between you and your doctor. Finally, I think it is important to note that while I think there's a tendency to blame hormonal changes for everything, which is just a cultural narrative that we have in America, I will say this is one time where that narrative can be somewhat correct, in that after menopause, for many women, it's not that you're automatically going to gain 20 pounds, but it is highly likely that you may notice some weight redistribution. So there's a little bit more around the middle than there was 10, 20, 30 years ago. That is something that often happens with the hormonal changes that happen with menopause. And so again, depending on where the fat ends up, if it's more superficial versus visceral, that really informs the steps you can take to manage it. But that is a great question. Thank you so much for sending that in. Okay, next question. I have a question. I've been on Zepbound since February 2024. Still going strong on Zepbound 15. Can your body get used to it though? Because my weight stalled at 140 pounds. I was thinking about changing to Mounjaro to see if it would help. I'm not sure if it would. Okay, great question. So if I had a patient who came in and they were on the highest dose of Mounjaro or Zepbound and they wanted to change to the other, I would tell them don't, because they're exactly the same. They're both tirzepatide, and so it's basically just the pen and the sticker that have changed, and the name. But the medication itself is exactly the same, so I'm not expecting a different response. But it can be very confusing because each weight medication has at least 2 names, if not 3. So for tirzepatide, tirzepatide is the actual name of the medication. The brand name for weight treatment is Zepbound, and the brand name for diabetes treatment is Mounjaro. So they're exactly the same. If I had a patient who was interested in switching, I would say save your time and your money and stay on this medication. And let's also talk about what else you're doing for maintenance, because of course I actually have a lot of clients where this comes up for them in terms of when you're talking about maintenance, and maybe they're getting their medication from someplace else, but they're seeing me for the lifestyle component. You really want to make sure that everything else is dialed in too. So maintenance includes not just your medication, but are you exercising the way you want to exercise? Are you eating the way you want to eat? Do you have this dialed into where you're happy with where this would be forever? That is a really important part of thinking about maintenance and making sure that it is sustainable for somebody. So what a great question. But yes, if I had a patient like that, they can save a lot of time and frustration with insurance companies and not change. Again, if you have a question, you can leave it on this video or another video and I will add it to the list. And if you want to work with me directly, I do work one-on-one with people as a weight loss coach to help them with the non-medical aspects of their weight loss. If they're on a GLP-1 and they still can't get themselves to the gym, or they're on a GLP-1 and they're very confused about what's going on with their food, I help people with this and so many more issues. So I'll leave all that info down below. Thank you so much for watching and please be well.